Good morning, everyone, and hope everyone's doing well. I'm looking forward to an engaging and interactive session with everyone today. We have, some really intriguing and to us, we think they're very pertinent and very practical role plays for you that we think you would meet in your practice as you go out there as healthcare providers. One thing that we want to look at in this pandemic is the role that telemedicine has played in our consultations and the way we conduct our interviews. And very interestingly, with us here in the southern part of the Caribbean transitioning more to telehealth, the messages and the tactics have remained the same, the content that is. So whereas, we would have done this in person, we find that the consultation and the conversations, they adopt the very same methodology. So I haven't seen a need to change the algorithm in a sense, if you want to call it that, or to, adapt. The 5 E's, the 5 R's work exceedingly well, especially in this climate of the pandemic. And, with COVID-19, we're seeing those who are interested in quitting smoking, they are very much more motivated. It is a big motivating factor for persons who are concerned about the effects of COVID-19.
Thanks so much, Dr. Bastio, for such an excellent introduction. I think you brought us some really, really important points, especially the fact of the situation we're living in right now with where telemedicine has become more prominent. So I just want to welcome everyone to our session today, our first practice session for this course, where we'll be exploring different scenarios of delivering brief tobacco interventions to patients. I just want to quickly remind everyone of the agenda. So we are doing very brief welcome and greetings, and then we're going to split up into breakout groups. We have 3 groups, each led by one of our course tutors. And in those groups, you will explore the different scenarios, receive feedback, guidance, and do the activities that we have planned. After the 35 minutes of those breakout groups, we will move back into the main group so we can have a discussion all together about anything that you would like to know, any scenario you want to go over, or any questions you have. And then we will close off our session. So it's a short but very interactive session today. I know that we have Dr. Singh with us today, who is the Regional Data Coordinator. You all know her from the Tobacco Control Team and the PAHO Regional Office of Washington, D.C. So I would just like to invite Kavita to say a few words before we start.
So pretty much today's session is for us to put into play what we have learned so far as it relates to the 5 A's. And tailoring advice. So I would, if there's no question at this point in time from our participants, then I'll ask Jessie to take us to the breakout rooms.
Thank you so much, Dr. Singh and Andy. We are ready for our breakout rooms.
Good morning again to our participants, and we have Delacia, we have Laura, and we have Nalicia. I think it's your name. Sorry if I have it wrong. I'm not doing that intentionally. And so this morning...
You have pronounced it correctly. Thank you.
Okay, great. So this morning what we're going to do is have a very interactive session amongst the 5 of us. So it'll be myself, Erica, and the 3 of you. And what we'll actually be looking at this morning is 5 case scenarios, and they're all different scenarios. And what we are expecting is that from the 3 of you, that we have full participation, of course, and so for each of the sessions or each of the case that we do, we're going to expect one of you to volunteer to be the healthcare provider and another one to be the participant. The case study that we're going to read out to you is actually that of the participant or the patient, if you want to say that. And then we expect the person who is, sorry, I'm getting a feedback and it's not from me. But as I was saying, the person who is going to be the healthcare provider is expected to confirm the situation based on the scenario that is presented by the patient. So as I said, we have five cases, and we have half an hour. Well, now about 27 minutes, and we will try to complete all of them. However, Erica, I'm going to ask you if we can go ahead and read the first case study, which is the case of John, if I remember quite well. And whilst Erica is reading the case study, I'm going to ask between the three of you if you can consider who's going to be the patient and who's going to be the healthcare provider. So over to you, Erica.
Great, yeah. So this first case study is about John, who's a 27-year-old man who comes to your clinic saying that he's experiencing some uncomfortable discussions with his fiance, who constantly complains about his bad breath. When you take a history, you learn that John's been smoking since he was 12 years old, and he becomes very irritable when he's asked about whether he wants to quit. So we'd like for you to, again, with one of you being John and one of you being you as the clinician, to practice how you might deal with such a situation in your clinic. So you're all three going to be doing these next several case studies and alternating as patient and doc. So should we, anyone who's going to step up, or should we be interventive and dub you patient or doc? Delicia, which would you like to do first?
I'll be the patient.
Great. Laura, you wanna be the doc? Laura, you're muted. Okay, so maybe we have to wait for a moment for Laura to be the doc. I'm sorry, is it indeed Senor Jack? But I'm sorry, I don't know how I'm to refer to the person where that's their written name.
I'm sorry, but it's actually Milicia. That's the name. I think who is there as Senor Jack. So,
Right. Noisha, yeah?
Milicia.
Milicia. Okay, great. So, Milicia, are you ready to step in as the doc for this first one?
Okay, I will give it a try.
Excellent. And then we will, oh, that's Laura saying she'll give it a try. Okay,
No,
terrific.
it is Melissa. I am with
It is
Laura.
Melissa.
I am
Oh,
with Laura. I am having some problems with my connection.
I am so glad that you found the solution. Great. So, Melissa and Delicia, if you guys want to start, and then maybe in the second one we can switch and add Laura. All right, have at it.
All right, let me indicate to you though that I'm traveling today, so I'm in the airport. I'm trying to stay in contact, even though I'm traveling. So if you hear any noise, just letting you know that.
No problem. Thank you. Please go ahead, Delicia.
So at the doctor's office. Good morning, Doc.
Good morning, John. How are you today?
Well, I am not doing so well today.
And
I'm
why
having
is
a
that?
bit of some issues with my girlfriend who talks to me about my breath not smelling well?
So let's see how best we can address this issue. Before we start, I have to ask you some questions.
Okay, go ahead.
Do you smoke?
I used to.
How long ago you used to, so you don't smoke anymore?
Well, sorry. She said, I'm trying to remember. She did say that the person was smoking.
That's right.
Yeah. So yes, I do smoke.
How long have you been smoking now?
I have been smoking since I'm a teenager.
Okay.
So that's
Pretty long time.
a very long time, yes.
Okay then. And also, I take it for granted that you do your personal hygiene in terms of your regular dental checkups and so on.
Yes, I do. I try my best to visit the dentist at least once a year. I do my cleaning. So I'm regular. But this is the first time I'm experiencing a problem like this.
Okay. So we know also that smoking could alter your breath. And seeing that your girlfriend is having a problem with it, how do you feel about quitting? Now is a good time to try and quit smoking.
Quitting for me is not really a position that I'm in right at this moment. For I feel that I've been doing this for majority of my life. It's a part of my life.
So let me understand. You're not quite ready to quit as yet.
No, man. I don't feel I need to. It is something that I'm accustomed to doing for years. I've never had a problem before.
What is important? What is most important to you at this time? In terms of your relationship with your girlfriend?
I would like to keep my relationship with my girlfriend, but what does that have to do with me quitting smoking?
As you can see, a lot is going on with her, and she is certainly having some problems because the complaining has started and it's probably not going to stop. So now might be a good time for you to quit smoking, but I'm getting from you that you're not ready to do that just yet.
I feel that, as I said, it has been for years. I don't think I need to. It's something. Why is it all of a sudden that I'm having this? Why is it smoking is causing this issue? I don't think I need to quit.
Well, let me just give you some information. Smoking in itself increases your risk of getting a heart attack. Smoking also compromises your lungs in terms of your respiratory, your ability to breathe properly, because there are so many chemicals in tobacco smoke, including tar and other substances about 69 of them are cancer causing, and you have started smoking at a very early age. So the longer you smoke, it puts you at risk for a lot of health problems.
Look, Doc. All of these health issues that you're talking about, I just want this bad breath to go away. That's all I want. I don't see why I need to stop smoking. I've been doing this thing for 12 years. I don't need to stop. So can you just tell me what I can use, get rid of the bad breath, and we finish with this conversation?
Getting rid of the bad breath is not that easy. There are benefits to be had from not smoking, and getting rid of the bad breath is one of them.
All right, so since that is the option, I think I'm going to just try to change my toothpaste or try to change something and see what happens. Thank you for your time. I might have to check somebody else.
Okay. See you next time. Take care.
All right.
Okay, thank you, ladies. Thank you so much for your elaboration of this case. Can I ask whether what's her? I'm sorry, that was Delicia and Laura, and I think we have lost someone.
We have Milicia on with Laura.
So, Delicia, do you have anything you want to add, or you still can't hear us?
No, I'm hearing you. It's Delicia you said and
Nelisa.
Right. Sorry.
Yeah, I was speaking to Miss Julia.
Okay.
I'm sorry. I think for me, I'm just noting because it's the case that he was irritated, and I feel that even though it's sometimes not said that body language, in terms of body language, because it would show, and I don't know if we could have, if there is a way to bring up the information around about not addressing so much, because I think the irritation could have been caused by just being uncomfortable about the bad breath. I don't know if I'm making sense. And if it is that we can, instead of addressing it head on, find a different way of approaching the situation. I'm just feeling that if you're uncomfortable with something and already have that wall, then there needs to be another way around it.
Thank you, Delicia. But one of the things that I would like to have added, if I were the healthcare provider in this scenario, is the fact that definitely we have evaluated what more or less seems to be his problem, which is definitely related to that of his bad breath. And you wanted to know his perception. That would be my first thing. Well, do you think your breath smells? Because if he cannot perceive that he has a problem with his breath, but his girlfriend is telling him that, well, then that's a topic you would want to discuss. The next thing is it seems he came because he's worried about his relationship and not his bad breath per se. So, and it's obvious that he's been doing it for quite a number of years and he's not open to an approach of quitting. But at the same time, you want to try your best to let him know that even though it might not be responsible for like a dental or oral issue at this point in time, but smoking can relate to other conditions such as stomach ulcers, which can give you a bad breath. And, as a result, you will suggest that he
does a double check with his dentist as well as a gastroenterologist if such a facility is available. And because those are areas again where more than likely he might be getting some sort of counseling as it relates to his habits that's causing his condition. And of course, you want to let him know that his smoking is causing or can cause some harm to his girlfriend. Due to the exposure of secondhand smoking. And pretty much that's it. Sometimes you just have to be a little bit firm, understanding that they would not likely to want to quit at the first instance, and that's okay, as long as you take the time to give them that necessary information that they need. So we have 15 minutes remaining, and we have another case that I'm putting in the chat, which is that of Justin, who is a 40-year-old male.
Kavita, before we go on, I just wanted to suggest that being responsive to one's patient, I think that this patient clearly was in pre-contemplation, right? And also doing the 5 A's kind of in the order that they're suggested, so that if you advise before asking them about their readiness to change, that might produce a little less resistance, right? So if you do those first 2 A's first of asking and advising before you do the assessment piece, and then it also at the end, saying, well, you may want to try these interim measures, and why don't we check back in a couple weeks? Because I think that Melissa, if I'm saying your name correctly, finally, John ended up really resistant at the end. So that would be, in terms of using the 5 A's, that might be a good way to proceed. Okay. Yeah. Kavita, do you want me to read it, or do you want to read it?
You can go ahead and read, and it's also in the chat.
Great. So second case is another man, Justin, 40 years old. His friend is in a hospital being treated for COVID. He presents to us inquiring about reducing his chances of contracting COVID, as well as the things that he can do to prevent hospitalization. He's fully vaxxed and a smoker. And what kind of advice can you present to him? And Laura, do you want to be the doc here? And Delicia, do you want to be the patient?
Not a problem.
Look. So who's the patient? Laura is, or I am? Sorry.
Laura's the doc, and this time you get to be the patient, Delicia.
I was a patient last time.
I'm sorry. I'm so sorry. Flip it then. I'm sorry. Delicia, if you want to be the doc, and Laura can be the patient. Thank you. Pardon me. So Laura / Justin, you want to present your chief complaint then? Or your question?
So, Doc, what's up?
Hi, good morning. How are you today?
I'm not so good, Doc. I'm here visiting a friend of mine, and been trying to encourage him to take the vaccine. He didn't take it. Now he have COVID, but they're telling me that because I smoke, I still not covered. So I want to know what is happening. If I need to go and visit him or just walk away, because I really can't handle this COVID thing.
Okay, so let me ask you, Justin, do you smoke?
That's a positive, Doc. The greatest feeling you could get.
Sorry, I didn't hear you.
It's no greater feeling you can get, especially when the wife's stressing you out. You just light up a chalice and you're good to go.
Okay, so you smoke. Do you share that chalice with anybody?
Well, if we're doing it on the block here and them boys around, we pass it around. But most of the time, I would sit down in the porch home and just chill vibes.
Okay, so a few
Hello, everyone. So sorry to interrupt you, and I apologize sincerely. I just wanted to let everyone know that we have about 10 minutes remaining or so.
Thanks, Jessie.
Yeah, no problem.
Great.
Please.
Great, thank you. Please continue, doll.
So, Justin, just to let you know that because of how COVID is spread and what it affects, smoking affects your lungs. COVID would definitely affect that. And so, because of that, smoking right now is not the best thing. Your immune system would already be affected because of your smoking, and adding COVID to it, it makes you at this point open to actually being easily being able to pick it up. That's one. Two, if you're sharing your cigarettes with person, then you are at a high risk as well of contracting COVID. So you want not to be sharing your cigarettes with person or participating in any smoking activity that would require any form of sharing. Remember that COVID is an airborne disease, and you can contract it through persons coughing or sneezing. So that's the saliva that is being used when you smoke, that in itself carries it. So you have to be careful when you are around persons, especially the person who is your good friend. Nothing is wrong with visiting him, but if you're visiting, you have to keep your distance. You have to ensure that you take all the non-pharmaceutical measures in order for you to keep yourself safe.
Doctor, me not take me going visit here again. Is that right? Thank you very much. I will think about fitting later on.
All right.
Okay. Is that the end of your conversation, or is there would anyone either you, Delicia, or Laura, or you, Melissa, do you have thoughts about how you might take the conversation a step further and use this as an opportunity to move the patient into at least contemplation and perhaps even action around thinking about quitting?
So the idea that he is willing not to go to the friend, I think that could be built on, because he's concerned about contracting it. So then using that same COVID as a means of getting him to understand how his smoking is actually affecting his health, and trying to steer him in that direction.
Nice. Other thoughts from others on how to capitalize on this to move your patient forward in contemplation?
So that opportunity could have been expounded where you take them to the assess, where you help them to make a quit plan.
Yeah, certainly starting to explore that would be great. I would also add, and then maybe we can quickly, Kavita, if you have things to add, and or we could move into the last case for a moment, that I feel like we as a public health community, a health community, haven't capitalized enough, frankly, on the fact that smoking causes most of the important pre-existing conditions that can compromise someone's risk of COVID, and using this as an opportunity to sort of build on that tragedy to get people to quit, I think is potentially a powerful tool. Okay, sounds like Laura and Melissa, since you're together anyway, And Delicia has to step out for a second. Kavita, unless you have anything further on that one. Lauren, Melissa, do you want to tackle the last case that we'll do of Simone, 39-year-old mother of 4 kids who are between ages 2 and 8, and she's got a 5-year-old child who's asthmatic, and she presents saying that both she and her partner are smokers. So you guys choose who's Simone and who's the doc. If one of you hasn't played one of those roles, I think Laura, you were the doc before, so maybe you could be the patient, and Melissa, you could be the doc. Is that right? You're muted, Laura's.
Nelissa was the patient before, and Laura was also a patient. So Laura will be the doctor now.
Great, thank you.
Oh God, no. In my blank.
Or if that produces an oh God no response, you can switch the roles. But please just go ahead and proceed with either of you. Yeah.
Good morning, and how can I assist you? I'm Dr. Alfred. What can I do for you today?
Good morning, doctor. Well, I came today because I'm having a problem.
Okay, so tell me, what can I help you with?
I have 2 children, and they're asthmatic, and they've been having a lot of problems since the rainy season started.
What problems have they been having?
Shortness of breath, the asthma coming on very often, and things like that. But let me just tell you all in one time, me and my boyfriend does smoke too, so I don't know if that have anything to do with it.
Okay, so what you're saying to me is that you smoke around these children?
We smoke in the house and sometimes on top of the veranda, and not necessarily in front of them, but sometimes they might come and I will say, well, bring that for me, bring that for me, and so on. So they might come around, but not for no long time. Really, I don't smoke in the house. I mostly go outside in the backyard or on top of the porch or something.
But tell me what you know about asthma.
Well, sometimes they just wheeze a lot and they get very sick, like them can't breathe properly and things like that and so on. And we just get real scared if they get like that and have to rush them to the emergency room very often and make sure that they have the medication and so on.
So with asthma, their lungs, their breathing pattern is already compromised. It means that they're having difficulty to breathe. And with the smoke in the atmosphere, it's going to even make them more congested. That's just giving you a layman table of it. So secondhand smoke, because they're not actually smoking and they're receiving secondhand smoke, it's going to trigger their attack more often. Because the smoke, it attaches to the wall. So even though you don't see it, it attaches to the wall and it becomes third-hand smoke for your children. So once they touch the areas that the smoke would have been on, this is going to affect them too.
So are you saying that when I smoke and my boyfriend smoke, even though the kids don't inhale it all the time because they're not around me, if they could get in the smoke, get in touch with the smoke different how, like touching the walls, and I never know that.
Yes, it can. And that smoke carries as much nicotine and tar in it as if they would have ingested it. Now, with you having to go to the hospital quite often to get medication, Does it affect your pocket?
Well, them not have to pay for the medication, but sometimes we have to take the taxi, and sometimes a little change me have, and then I don't have to pay the doctor to see them, but then the medication them very expensive, especially the hospital I have none.
So I'm gonna ask you, if you were to stop smoking for a month, do you think you would visit the clinic less and you would get a little bit more money in your pocket?
I never think about that. But
So-
now that you tell me, so maybe it's something we can think about.
And don't you think you would receive a benefit where your children would be a little bit more healthy? You would have a little bit more money and you get a little bit more time at home?
Now that you put it that way, I can see that happening.
Smoking affects your health. It's one of the risk factors for a lot of health conditions. Your children are already with asthma, so it can weaken their respiratory system. We're in a pandemic where we have COVID, and because COVID affects the respiratory system, the fact that they already have asthma, they can get COVID more easily. Smoking causes cancers. So you as a smoker and your children, you're affecting both health. So I want you to consider quitting smoking for the benefit of your children and also for your own safety. Okay, Simone?
Okay, Doc.
Finish.
Thank you.
Yeah, the only piece that I might add, and Kavita, I'm sure you'll have thoughts too. That was really good that you looked for ways that she could be incented to stop, in addition to the terror of having to deal with her asthmatic kids. The only thing that I might suggest is the arranging part, right? So making sure that this doesn't just become a patient being polite to palliate you, but to say, shall we follow up in a few weeks, and you can let me know how your child's asthma has gone after this 1 month trial and how your smoking is going. That might be a thing to consider. Kavita, did you have anything you wanted to add before we get put back into our common room?
No. I have nothing to add. Sorry, you covered everything, and I think the girls did a really good job into covering everything that I felt they needed to cover. So kudos to them.
Super. All right, we'll be in the out of breakout.
Okay, hi everyone and welcome back. I hope that everyone enjoyed doing the role play scenarios and learned something new or something interesting. Are there any groups that didn't get to complete a particular scenario or anything that you'd like to go over with a particular scenario?
We tried and almost addresses the 5 scenarios. We couldn't finish the last A, the third A of this 5th scenario, but in general, we managed to talk about the different scenarios.
Yeah, similarly, our group, we didn't even attempt the 5th scenario, which worked out well because we were able to focus fully on the 4 scenarios, and we went well with those 4. So we didn't do the 5th scenario. Yeah.
And neither for us. We were not able to. We only got 3 done, so we didn't get to do the last 2. So yeah, I guess once we have some time, we could probably do that one. But over to you, Hassan.
Yes. Okay, great. So yeah. Oh, sorry, Dr. Frank. Yeah.
All right, I was just going to say it. I really thought it was engaging, though, to do some reflecting on the scenario, and yeah, I hope we'll have a chance in the next 15 minutes to share some of those reflections that we came away with. Go ahead.
Yes, thank you, everyone. So once more, on behalf of the team here we'd really like to thank you all for your participation today and your enthusiasm shown. These are the ways that we know that you are being engaged, and we see the enthusiasm, and we really like to commend you all for that and for the participants in the groups. Okay, so today we want to tie in, with the last module, what we focused on in terms of the 5 A's, and specifically the first 3 A's in tailoring our advice to the patients. So the 5 scenarios would have been 5 individual persons and 5 individual patients, each with their unique story. And what we really want to drive home to you all is that smoking cessation and the strategies used that have been developed by the by WHO is one that we need to get down to the personal level of the patient. So bearing in mind all the extensive knowledge and information we have as healthcare providers about tobacco and its ill effects on the general health and so many things, our consultations must be very individualized. So one of the things that we want to remind you of doing is that ask at each visit, and this must be, keep it very simple. Don't use language or stuff that might be confusing to the patients. And we must give advice once we pick up someone is smoking. And what was done well today, especially in our group, and I'm pretty sure in all groups, the advice was very much tailored. You want to make sure that your advice is very clear, very firm, not harsh or aggressive, but strong. It shouldn't be ambiguous. Well, I think, or maybe, how about, as a healthcare provider, I recommend that you quit smoking as soon as possible or immediately. And smoking, as let's say, has been shown or proven to increase the risk of transmitting or getting COVID-19 and even worsening the chance of severe COVID-19 disease. Make that very clear and a very strong and well-tailored statement. And, these are the things that we've seen you all done well. I had a lot of fun using the scenarios online. I think that was a really good use of technology with the 2, I believe it was Martha and another, I can't remember the name at this time, on the module. And you would see how, what you can do is go back and see how the person reacts to you not tailoring the advice to that individual. Okay, so let's get some feedback from you all. Anyone has any questions? And if so, we can just provide some quick feedback on any concerns or questions anyone has. You can place your questions as well on the chat, and we'll try to answer them for you.
Any question or comments, or even on the different topics the cases addresses, because we are in a learning process, and I wish to share a sentence that from a Canadian cardiologist long time ago he provided to me. A smoker do not need lectures, they need help. That is very important. As Basan said, we need to really get the point that they are looking for at the visit, at the consultation, address this problem, and then try to go further, and using open questions, because if you don't know if they are ready to quit or not, you need to open. Do you know the relationship between asthma and tobacco, for example, or diabetes and tobacco. So it's not you start talking about the diabetes and tobacco. You ask permission for that because you respect the other, and you are doing that because you are your healthcare professional, your doctor, your nurse, and you're worried about your health. That's all. Any comments or inputs from the group, please? Don't be shy.
Yes.
Does anybody have a particular scenario that you'd like to go over? Maybe one that you didn't get to address in your group?
I just have a question and a comment and a question. Good morning again, everyone. In terms of the simulation, I just wanted to find out if I can keep doing them because I feel that I would want to do some more, and I found it very effective.
Yeah, absolutely. You can do them as many times as you like to.
Okay.
Yeah, and so I'm going to call on Laura and Melissa, please, if I could, from our group. And could you talk about some techniques that you found either from this exercise or in general from your clinical experience that are particularly effective in engaging patients and making them respond in an undefensive and open way, like Eduardo was talking about?
Nelsia is not with me at the moment. She stepped out. But from my practice, what I find is that if you carry an air with you to say, well, oh, I am the nurse, I am the doctor, your patients or your clients, they put up a barrier towards you. So personally, I like to come down to my patient's level. So I don't know if you remember during my role play with Nelsia, I would have said to her, that's the simplest I could have gotten it to her, just to give her. Because when you speak their language, they feel comfortable that you can understand them. You try not to be judgmental because you don't know what their story is and the reason behind what they're doing, So you meet them on their platform, and before you know it, they find that they can speak to you about anything and you get more information. So sometimes what would have been a 15-minute visit turns out to be a 45-minute consultation.
Yeah, Laura, I noticed, if I'm recalling correctly, that you were particularly effective also as the patient, and you used a lot of colloquialisms that a patient would typically use in describing this. And it suggested to me that you were especially skilled at listening to patients and at trying to echo their language.
I got the prompt to change my password.
Because what happens with my practice, even before I ascended to a family nurse practitioner, just being a staff nurse, even after my work schedule would have finished, even in my uniform, I hang out on the block among the guys. Classmates or the associates, you stop by on the road and you say, what you drinking, hit me up. Even though you don't get engaged in their activities, you let them know that the uniform is never a barrier.
That's great. Do others have comments on that? Ways that you incorporate this as well? Delicia, I know that you had a lot of lovely components in your presentation too, both as patient and as doc. You're muted, Delicia, or if others would like to chime in.
Yeah, from any of the groups, if anyone would like to share their local experience and their strategies, and really want to take home the point that this is about personalized healthcare and really becoming an advocate for being an ear to the patient, because that's what they want. They want personalized attention and that sort of empathy and guiding them in this thing. Yes, Walima?
So, in addition to what Laura has said, another thing is not to criticize. So I've had several patients who tried to quit and then they relapse. And when they return, they expect that you're going to yell at them or scold them. I mean, I think at that time is very best to be sensitive, be understanding, and do not criticize, but just try to continue to work with them in order to encourage them to quit and actually use that as a positive that, you know, you did it once and you can do it again. And another thing that I do, because I see most patients with lung diseases, what I try to do, especially those with COPD and children who have asthma where the parents are smoking, or if from restrictive lung disease where people are smoking, I try to ask the question, if, do you know what is one of the main risk factor for your disease? So I let they make that gap bridge that gap between their disease and smoking. And sometimes they know it, but then when they say it, you can see that realization dawn upon them that, oh my God, it is me, you know, or even the second and third hand smoking, that it has been that as your risk factor.
Great.
Thank you.
Any other comment or input? Remember one thing, the patient, even those who are not ready to quit, they need to quit. And we need to understand that sometimes the addiction prevents them to understand our reason. And so they are trying to talk about their excuse. We cannot confront them. We need to find the way that they feel that what we are trying to do is improving their health. We cannot force them to quit if they don't want, but as professional, we have a duty, is protecting their health, their life. So we need to provide anytime this advice. So you need to tell them that it's your duty, and please don't be don't feel uncomfortable with my question, because I don't want that. I want to help you. I try to finish if they are not ready to quit in a positive way. This is my final message.
Thank you so much, Dr. Bianco, Laura, Walima, everybody who participated. We got some really, really excellent advice here. And I think that there's something for everyone that you might have taken away from this session. I think that we are all wrapped up here if there are no final questions, but of course, please feel free to contact us on VCPH or email at any time at all. And letting you all know, there will be 2 discussion forums that will be opened after this session for you to participate in. That is going to be based on this session that you have taken part in. So that is going to be your activity for this week. And we look forward to seeing you next time. Dr. Singh, do you have any final comments before we close the session today?
Sorry, couldn't listen. Repeat.
Kavita, I think you're muted.
Okay.
Jesse had asked Kavita if she had anything further, but while we wait for her to unmute, Dr. Bianco, did you have anything you wanted to close with?
No, just thanks to all of you, and it's a pleasure for me to share with you our experience, and really, anytime you need something, please don't hesitate to contact us, because we are willing to help you on this matter.
Okay, thank you so much. I think we'll just wait a couple of seconds again in case Dr. Singh is able to unmute.
Hi, can you hear me?
Yes, we sure can, Dr. Singh. Thank you.
I'm sorry, but I'm not hearing you anyways. Once you're hearing me, okay, I'm sorry, but today I've really been having some off internet connectivity, like I said. I mean, for those of you who are connecting from Guyana, probably you share my pain. But that being said and done, we did have I would think a very interesting day. It's always useful to remember that, you know, the more you practice these sessions, the more you practice you're giving your 5 A's, the more you practice tailoring advice, you end up becoming a pro at this. It's just not something that happens overnight, but you have to find really intuitive and innovative ways of including it into your daily practice. And there are very subtle and nice ways that you can do it, that the patient doesn't even feel that you're actually giving them an intervention, but they feel motivated at the end of it. We do look forward for you to having a bit more participation in our next session that comes up on the 22nd. Jessie will do her usual awesome job of reaching out to you and sending you your reminders, where we have quite a bit more scenarios, and they're going to be a little bit lengthier, a lot more interactive, I might say. And of course, during that time leading up to our next session, just feel free to reach out to us should you require any additional help. If you still have any questions, any comments, we're always here willing to help. And Erica, I know I've been in Erica's group today, and Erica is the main tutor. But if there is something that you think that I might have said or you wanted to build on, just reach out to Erica, and if need be, she'll reach out to me and we'll get in contact with you for sure. And of course, Jesse's always there. I know Vasant and Eduardo, you are gonna keep up following through with your group members, and just remind them that for the ones who did not connect today, there is an activity for them to complete, and it's really important that they complete that activity once they haven't been able to join today. So good job, guys, and we look forward to continuing this course, and we've been going really great. So toodaloo, bye-bye.
Thank you, everyone. Bye-bye.
Bye-bye.
Thanks everyone for coming. Bye now.